I'm Dr. Brad Wolf here, and I'm here to help you to get rid of those nagging, bulging discs in your lower back, in your neck. Got to take care of them there. I can tell you from my own experience, I did triathlons for 8 years. During that course of time, and I was swimming, turning my head back and forth, I ended up wearing through a disc here and one in my lower back. You know, leaning over on the bike causes all sorts of problems. So whether you're having problems because you're sitting, you're doing manual labor outside, whatever the case is, sometimes you can start to develop some problems in that disc. The disc it's a sliver of cartilage in between your bones that helps to allow your body to be able to move and bend. And so we want to make sure that we're taking care of what I call your spinal architecture and keep your body symmetrical. One of the things that I talk about with people is that your body is not perfectly symmetrical, but we want the body to be as symmetrical as it can be. So if you look at the picture behind me here, you can see how the body is nice and upright. There's a natural curve and contour to the spine. The spine's right up the middle. The pelvis is level. The muscles are nice and balanced. This is what's called anatomical neutral position. We want to get the body in this upright position, and that's the very first thing that you need to do. The second thing that I'm going to show you here is about where to put the cold or the ice. We've been talking a lot about cold in these videos here, and we want to make sure that we're putting the ice right in the small of the back here. Sometimes we need to put it a little bit lower down. I'll turn around here so you can see that lower down here. You know, sometimes people want to put, especially if they're getting leg pain, they want to put it and they want to sit on the ice, and that's okay. But really what we want to do is we want to put that ice here in the lower back so that we help to take some of the inflammation away from the body and help that disc to begin to be able to heal correctly. The third thing is, and again, I sound like a broken record. That's because I am. I'm repeating. We need to understand what the principles are to make sure that we take care of this problem. The very key here is to keep that back flat. We talked a little bit about neutral pelvis. We want to make sure that the spine is balanced, that you have a good natural curve there. So especially if you're sitting for many hours during the day, we want to make sure that we're protecting our back, that you're not sitting like this all day long. That's going to cause a tremendous amount of damage. And so instead of that, we want to strengthen through our entire core here. People think of core, they go, oh, I'm working on my abdominals. No, your core is not your abdominals. It's 360 degrees all the way around. From here, all the way down to here. It's your butt. It's the front of your legs. It's your abdominals. It's your lower back. It's the whole thing. So we want to strengthen and think strength. Think strength, because strengthening is really what helps give you the support that you need in order to be able to stay strong and to be able to allow healing to happen. When imagine that the foundation of your house is settling and the walls are cracking on the side. Well, we're not going to go start patching the walls on the side. We want to fix that foundation so it's nice and strong and stable. And the more stable your body is, the more that tissue is going to be able to heal and repair itself. So get some ice on that back. Make sure that you're keeping your back flat and start moving towards having a more balanced architecture in your spine so that your muscles, your bones, your nerves are all working together to help to protect you. Stay tuned for the next video. I have no idea what we're talking about next, but you know what? Come check it out. We appreciate it.